So in this video, we're going to show you how to set the older Alaris pump. If you would like to see a video on how to prime any of your lines, please go ahead and refer to the new Alaris video that is available on the same YouTube channel. But for this, we just want to show you if you were to use this pump, how do you kind of put the little chamber in, the channels, all those little connections that we have. So I want to turn my pump on. For this one, I have an IVAC, which is right here. When this is down, it's closed or clamped. So right now it's clamped. If I were to push it up, it would be open. So I know for this particular pump, this has to align in here. So there's a little spot for the IVAC to go. So this just kind of pops into place over here. And then you bring this little black lever to the side, and you see that opened up my IVAC. So now my pump is going to be the one controlling the fluid based on whatever I set my pump to be. So, but please remember again, your tubing would have had to be primed again, so it's free of any air. Okay. So for this one, it's asking me, is it a new patient? I can say yes. So for this, I'm going to have to hit the little blue circle under the yes. Okay. And this does not have any pre-programmed medications within it. So that's why the new Alaris is the one you'll see currently used, simply because it has those safety features of having guardrail draws. So for here, I'm going to base it off of, again, whatever's ordered by my physician. I've done my checks. I'm going to put my rate at, I'm going to say my order is 100 milliliters per hour. I can hit enter to go down to the next line. The next line is VTBI, so that's again volume to be infused. That's based on my volume I had in my bag. So if this was a fresh bag of normal saline, again we would say it was 1,000 milliliters. I can put maybe like 980 or 990, something just to cut it a little bit short depending on how much fluid I lost when I was priming it. I'm going to say I didn't lose too much, so I'm going to put 980. That's when the pump is going to alert me that it's dry, and hopefully I still have some fluid in here. So I'm going to hit enter. The next one here is VI, so that's volume infused. So I actually am not going to put anything into there. That would be the pump that's going to tell me a number as it's going along and infusing into the patient. So right now it says 0.0. I can hit enter. That's fine for me. Okay. So now this is flashing until I would go over to my patient. Again, I've already done my ID check, my 3 checks of those 6 rights. I'm going to wipe off the report. Okay. Let that air dry. And this would have a nice little cap on it that you could have. But again, this has been reused a few times. Get rid of any air bubbles. We'll say this is air dried completely. So you're going to put that in. So that's that lure lock. Again, I would have a little clamp here I could undo. You can push a little bit. You can pull back to check for blood. And let's say I see blood in here. That's perfect because I want to be in the vein, so I'd want to see blood. Then I can push that flush. So I'm making sure before I hook up the fluids that my patient's not having any pain. They're not having any signs of infiltration or other IV complications. Okay, so that's completely flushed. I'm going to now attach my line by taking that little pokey part. Is going to line up with the blue. So you stick that together and then it twists to lock in place. Okay, so this would have a clamp here that would be open. There's nothing else clamped on my line, so now I can come back here after all my checks have been done and I can hit run. Okay, so now my primary line is going to be running per my physician's orders. If I were to have orders for a secondary, again, all those checks have to happen. I'm going to hang this lower, just like we did with the other Alaris. Those principles don't change. Your piggyback always goes lower. I always like to think of your primary always goes lower. I always like to think of your IV piggyback as taking a piggyback ride on top of the big guy. Okay, so I can either hang that super low or bring that hook over. Okay. And I've already primed my secondary line just to kind of expedite this a little bit. So again, all the air has been removed from the line. I can swab this with alcohol. Depending on what types of lines you're working with, you may have chlorhexidine swabs. For this, it's just a normal peripheral line. Alcohol's fine. I'm gonna let that dry. So in that time, I can put this on hold. Okay, while that's drying, I can go ahead and where is it? And on here, let me say this is dry now. I'm gonna connect this. So again, it's always connecting to the port above the pump. So again, this is above the pump. Okay. And so for this pump, you have to hit the SEC. And notice that that's in the middle of both my channel B and my channel A. Right now, I'm just working with channel A. And so right now, because this is flashing over here, I know that's the side that I'm controlling. So I'm gonna hit the SEC for secondary. And I'm going to set it based on, again, whatever rate is ordered for my particular medication. So I'm gonna say it's ordered at a rate of 100. Oops. Here. Sometimes it just gets a little alerts to you, just follow whatever the prompts are. So I'm gonna say clear. I'm gonna do 133. So 133 milliliters per hour is gonna be my rate, again, based on whatever is ordered. I don't just make that number up. And then I can hit enter to go down to the next line, which is volume to be infused. My volume to be infused, I base that again off the volume of my bag, so 200 milliliters. Okay, and then I hit enter. And so right now, all of my settings are in. Again, I've done all of my checks. Again, you did not see me physically do all the checks, but I'm just letting you know that you would have to go through all those 3 checks of those 6 rates at the minimum. And so now that everything is set here, I would want to make sure that my clamp on my secondary line is open, and then I would hit run. Okay, and same principles as with the other Alaris. As soon as this is done and it's pulled at a rate of 133 milliliters per hour for 200 milliliters, then it's going to kick back over to whatever setting I had for my primary. So again, my volume here has to be appropriate so I don't accidentally give something at the wrong rate here. And it's just a quick few tips for any of these pumps. If you have anything that's alerting you to a downstream occlusion, always check from that point of the pump down to your patient. If it's upstream, it's above the pump. And if it's telling you there's air in the line for any type of pump that you're working with regarding like IV pumps, it's only going to be able to see air here at the pump. So you may have to pause your infusion, disconnect it from your patient, and work with getting that air bubble out. Okay? And then again, for turning off this pump, you would hold that power button. Okay? Thank you.